Hey, it's Austin. So a couple days ago, I had a consultation about top surgery with Dr. Crane in the San Francisco Bay Area. So I wanted to tell you guys about that, tell you what I learned about his surgery and cost and about insurance stuff, in case anybody is wondering. Um, I do have a cold right now, so if I cough, I apologize in advance. Um, Yeah, so I went on Wednesday, which was April 30th, 2014, and it's May 3rd today. Um, all right, so yeah, so for one thing, I was there towards the end of the day. My appointment was at 4 o'clock, and they were running about an hour late, which was kind of unfortunate. But anyway, I definitely got to check out the waiting room. It's very nice, very fancy and peaceful. And the ladies that work there in the office, like the receptionist and, like, I guess, nurses, were very nice. Dr. Crane was also very nice, very personable and respectful and friendly. It's funny though, like, he's very to the point, matter of fact, talked briefly. Um, he totally reminded me of my shoulder surgeon, my orthopedist who did shoulder surgery on me. Like, just that surgeon personality, I think. Like, you've got to be, um, like, confident, and then you even hyper confident, and you end up making your patients feel confident in you. And, um, I don't know, to be a surgeon, you're not like uh, that touchy-feely, I guess, to be able to deal with cutting into people. I don't know, but he's very friendly, just like to the point. So anyway, um, they called me by my preferred name, Austin, for the whole time. Um, and that was nice. The lady took me into Dr. Crane's office. He was sitting at the desk. I sat across from him, and he was like, "Hi, nice to meet you, Austin. So, what questions do you have?" Like, no lead in or anything, just like, ask me your questions. So, luckily, I had printed out a bunch of questions, which I definitely recommend for anybody doing any kind of a consult. Um, so I asked him what type of surgery he thinks would work for me, like double incision or keyhole, because, like, I'm kind of small, but not totally flat or anything, so I wasn't totally sure. So he was like, "Well, if you want, I can take a look. You can take your shirt off." So I was like, "Well, yeah, I mean, I want to know that." So um, I just sitting there across from him at the desk, I just like took my shirt and everything off, and in like 1 second, he was just like chilling there, like, "Oh yeah, like, yeah, the keyhole wouldn't work for you." So, yeah, so I would be getting double incision surgery, which makes sense. I'm not terribly surprised by that. Um, all right. So, I guess I'm going to go through my questions right now that I asked him and tell you the answers in case that answers any of your questions. All right. I asked about nipple sensation and the results that his patients have with that. He said that 10% of his patients who get top surgery end up with apparently totally full sensation in the whole chest area and nipples, um, down the road after they've healed. And then 10% have no sensation later on after they've healed. And then the rest of them, the 80%, have partial sensation. So that seems like the most likely outcome. It sounds like the most likely one is that I wouldn't have erotic sensation. But, I still think it'd be worth it for me. And on his website, it says that he doesn't use drains, like you don't have drains in after the surgery. So I asked him, well, then would the patients have increased swelling or something if the fluid is not coming out? And he said that he leaves enough lymphatic tissue in there so that this tissue will like soak up the extra fluid and it'll just go get rid of it, you know, back into your body. So I was like, oh, well, that makes sense. That's cool. And um, I'll say a word about the cost in a minute. Um, so I asked about complications. He said that, well, my notes are not totally clear, but it sounds like something along the lines of hematoma, you know, like, or maybe he said excessive bleeding, something like that, was like 2 to 3% of people. But he said it's never to the point where he would have to do like a blood transfusion or anything. He said he's never had anybody who needs a blood transfusion. And loss of a nipple or part of a nipple after the nipple relocation would be 5 to 10%. That's the rate at which it happens for all the patients. And then I asked about revisions, like how many people want revisions. He said less than 1% of his top surgery patients want revisions. And that if you do a revision, he does not charge the surgeon's fee. And what else? So the top surgery, or I guess specifically the double incision method, takes about 1.5 hours to complete the surgery. And I asked, would I be intubated during the surgery, you know, like have the breathing tube? Because I don't want that. I'm a little freaked out about that, but I can deal. But he said, yes, I would be intubated during the surgery. I also asked, would I have to have a catheter during the surgery? Because that also freaks me out, even though I'm sure it's not a big deal. I just don't like the idea of that. But he said no. And you can, it was funny how he said it. He's like, yeah, you know, I tell guys, you can leave your shorts on during the surgery. I thought that was kind of funny. And I asked about anesthesia complications. He said he's never had any patients have any complications related to the anesthesia. And he said it doesn't matter, well, as far as the results are concerned, it doesn't matter if you're on T before the surgery or not. He doesn't, like, if you're already on T, he doesn't make you go off of it for the surgery. He said, like, don't try to, like, lose a lot of weight or gain a lot of weight or change your body. He said it tends to work out best if you just come in for the surgery just how you normally are. Because then the results would match you and how you normally are in your body, I guess. And I asked about recovery. Like, I know that for a week you're pretty much out of it, of course. But I'm a professor, so I asked, like, how long before I can carry my book bag, that kind of thing. He said, for the first 2 weeks, you're not supposed to lift or carry anything more than 20 pounds. But he's like, after 2 weeks, totally fine, you can do whatever you want. And I was like, I thought to myself, yeah, I'm sure that's not totally true. I'm not going to be lifting weights after 2 weeks, but I guess he means I can carry my heavy bag if I feel up to it. So, yeah, I asked my questions, and then that was all very quick. You know, like me explaining it just now was pretty quick. You know, it's not like that was half an hour. So it was a pretty quick visit with him. So afterwards, I thought to myself, oh, I can see how a phone consultation could work because it's actually quick. He answers questions really quickly and just needs, like, a glance at your chest to tell you which type of surgery would work for you. So, but anyway, I'm glad I went there. I'm glad that I met him and saw the place, because I think it would be more difficult to decide on getting the surgery and like schedule it if I hadn't even been there and met him. That would be a little uncomfortable for me. So I'm glad that I live close enough, like an hour, hour and a half away, so that I could go. So let me talk about money, cost, insurance. So if you are paying out of pocket, like without insurance, the cost for top surgery with Dr. Crane, according to what they told me, is $8,820, which is pretty much what I expected. They do work with insurance, though. They have like a contract kind of thing with a couple of insurance companies or plans. So, like, if you have that plan, it would be really easy to get covered, although I don't have it and I didn't pay attention to which plan it was. Yeah, so then my paying situation is complicated because I have insurance through my wife's work, and it would be wonderful if the insurance would cover some of it, but I don't know. So, a lady that works there, Jen, was really nice, really helpful. She took my insurance information. She said she was gonna contact my insurance company and ask if my plan would have any chance of covering top surgery, and she's gonna get back to me about that next week. So that's really helpful. I'm really impressed. So I look forward to hearing that information. Okay, I live in California, so I'm going to tell you about California, like, rules and stuff for trans stuff as relates to insurance. So, there's this relatively new law in California that says that insurance companies must cover medically necessary care for trans people. Transition stuff like top surgery, hormones, is considered medically necessary because it's medically necessary in order for you to live, as your gender, basically. But they told me at the office that employer-based plans that you get through work, even if you're in California, they may be exempt from this California law. So some plans through employers may not cover any trans stuff at all. I was like, oh, that sucks. So that might be the case for me, but I have no idea yet. But I wanted to tell you guys that. She also told me that most insurance companies are still going by the 6th edition, or whatever, of the WPATH guidelines. The most recent edition is the 7th, but a lot of insurance companies are not yet going with that one, which is lame. So, according to the 6th iteration of the guidelines, the WPATH guidelines, like, patients are supposed to be on T for 12 months, like living as male for 12 months, before the insurance companies will consider covering top surgery. I'm not on T yet, so I was like, oh, what if my insurance does that and I'd have to wait for a year or over a year? That would be disappointing. But then I'd have a new insurance anyway, because the insurance is slightly different every new year. But I wanted to mention that. So the 7th edition of the WPATH guidelines says that insurance should cover top surgery and that you don't have to be on T for 12 years. But the insurance companies haven't caught up with that for the most part. The office of Dr. Crane does want a letter from my therapist, letter of recommendation, saying that, like, I'm legit and all that stuff, because they said really important for them to have that on file so that when the office communicates with the insurance companies, they're much better to advocate for me and be convincing if they have a therapist letter. So I have to work on getting that from my therapist soon. And yeah, so just to sum up my own situation, in theory, I could get top surgery in August. They have a few appointments for surgery available then, pretty soon, because it's beginning of May right now. I would consider that, yeah, although it depends on the insurance, because here are my options. If my insurance will cover the surgery, like now, without me being on T for a year, cool. Well, yeah, then I might get it in August or sometime a bit later in the year, this year. If the insurance does not cover it in one way or another, either at all or because I haven't been on T for a year, then I've got to decide, do I want to wait till the new year when I will have different insurance? Or do I want to just get the surgery now and pay the $8,800? That would take some thought. Although I guess waiting a few months and saving like $8,000, I mean, that does make sense. Yeah. What are my other options? Well, yeah, that's pretty much it. The insurance covers it now, or I pay $8,800, or I wait till the new year. So I might have some more sense of what's going to happen next week when the lady at the office very kindly and generously finds out about my insurance and lets me know about that. All right then. Does that cover it? I feel like that covers it. So feel free to let me know if you have any other questions that I may be able to answer. Thank you for watching. Bye.